who are planning to have a labor and a vaginal birth, and you may end up with an unplanned or even an emergency cesarean. Now, if you hear drumming in the background, I'm in New Zealand. We have been in total lockdown because of COVID-19 for the past 2 weeks and will be for another 2 weeks. That's my neighbor. They drum. So just know that we're all trying to entertain each other. So anybody who is planning a labor may end up with an unplanned cesarean or an emergency cesarean, and those are distinctly different. When birthing better skills started to develop, as I've mentioned, and you'll hear it again and again, when I gave birth in 1970, there was a 4.5% cesarean rate, which meant all of us labored because the cesarean was done if women's lives were at risk, and it was major abdominal surgery. We were knocked out and we were cut from the pubic bone to our navel. It was very serious. So doctors just let us labor. Considering that the obstetric specialty only started in the 1950s, maternity care and development around maternity care has been very recent. In fact, my grandmother died of pneumonia before penicillin. I was born in 44, and I was the generation of people who had antibiotics. I grew up during the polio epidemic. When I became involved in birth in the 70s, they didn't have a ROGAM for people who are Rh negative. They didn't have ultrasounds. They didn't have a strap on your belly to fetal monitor. They just listened to babies. So the 95% of us who labored, we just labored, whether it was for hours or days, whether we had a good outcome or not. So we just have to keep reminding ourselves that the belief that birth is this natural, normal thing has been it's become twisted. It's now come to mean easy, manageable with a good outcome. That's never been accurate. And we can't control the circumstances around it. You might end up with a snowstorm, or you've had a fight with your partner who then stormed off and you haven't seen in 3 days. I mean, for goodness sake, the women in Syria, or the tsunami, or Hurricane Katrina, or the COVID virus. You can't control this. All you can control is yourself. And what we learned in the 1970s as we were developing these skills, all the hundreds of fathers and mothers, was that first we had to cope well with the natural occurring pain of labor, because the medical profession also wanted to save us from suffering. So they came up with different types of pain relief. In my mother's generation, they often gave women what was called scopolamine, which put you into a twilight sleep, and women really didn't remember birth. Other times, they would just give you just pain medication by a pill form, and then an intramuscular injection, because they didn't do a lot of IVs back then. Intravenous is very, very, very recent. We couldn't eat or drink, which meant many of us got dehydrated. So you need to understand that the modern maternity care is not a boogeyman out to get us. And I have been involved in this conversation for 50 years and have listened to the natural birth movement absolutely be an anti-medical movement. Now, you may be an anti-medical person. I worked with a lot of religious people who wouldn't have gone to the doctor for anything, so I understand that. And I, as the director of our New Zealand NGO, that's your choice. If you're anti-medical, be anti-medical. What I learned from 20 years living in countries where there was little or no medical care is if you're going to be anti-medical, at least have the skills to help yourself. And that's really what Birthing Better is all about, skills to help yourself. So if you're coming to this course from 24 to 36 weeks, prepare your body for birth. Because the most common reason that you will have an unplanned, non-emergency cesarean is because you labor for long, long, long periods of time, like we did when the cesarean rate was 4.5%. And we don't want to do that. And as we say in the courses, fathers really got it. This is an exercise in plumbing. You got a big object coming out of your container. If your container is tight inside and it doesn't open up, it's harder for the object to come down through and out. So we developed the skills to prepare our body for childbirth. And that includes preparing your birth canal, because you don't want to be pushing for hours. You don't want to blow your blood vessels in your eyes, for goodness sake. So you want to prepare your body so you can open up to your baby at each contraction. And at each contraction, you're faced with a reality, which is the contractions might hurt and they might be incredibly painful. So you have to open up when you're experiencing pain. And this goes against every instinct in our human body. When we are having pain, we tend to tense up. You can't tense up. The natural birth movement is constantly telling women to just go with the flow, do whatever you want. No, you don't want to do whatever you want, because most women who are in pain in childbirth get into positions that back off the labor and they back off the pain. That sounds good, except it's delaying the birth. And once your birth gets delayed past a reasonable amount of time, the medical profession is going to step in because you look tired, you look exhausted, you're not coping, you're overwhelmed, your baby's heart rate may start to change in response to that, and voila, you have a cesarean. Because it has just gone on and on and on. You've had a failure to progress. You haven't been able to get the baby into the pelvis. You've pushed for hours and hours, because the natural birth movement truly recognized, that babies could be injured by forceps. That's true. So the medical profession responded to that pressure, and they don't use forceps now. So you then have to have a cesarean, because it's safer for you to have a cesarean than for your baby to be damaged at birth. And I want to tell you, there has never been a lawsuit in the United States for an unnecessary cesarean. And if your baby is damaged because you've pushed for hours and hours, and you are living with a damaged baby, you're pissed off that the medical profession didn't save your baby soon enough. So we need to really get real about it. If you do not want modern medical care, do not go to the doctor. Do not go to the hospital. If you do not want medical care, don't go there. If you want medical care, then you cannot control what assessments, monitoring, and procedures you are going to have. You are not in charge there. They're in charge, and you're going into their environment. You also have to recognize that the midwife or the labor delivery nurse or the obstetrician, they're human beings, and they are not there to hurt you. I have never, in the hundreds and hundreds and hundreds of birth professionals that I have seen practice, ever seen anyone intentionally harm a woman. I have seen the bizarrest things happen. I mean, really very, very bizarre. They come equally from midwives, equally at home births as they come from hospitals, equally at birth centers. Very bizarre. And why is that? Primarily from our viewpoint, is because there has not been a societal expectation that you become skilled to birth your baby, which means too many people are just accepting birth for what it is. And that really is just a problem, because the idea that women should just labor for days and days and days, she's more likely to be damaged, and so is her baby. So, where are you with this? Prepare your body for birth. Learn how to create space in your body. Learn how to soften. When you do this and you work with your partner at home, or whoever's going to be with you, and if they're not with you during this period of time and they have helped you, then they know and you know that you know, and you will do better because you commit to birthing. And here's the secret that we have to admit. Nobody's doing the activity of birthing your baby but you. No matter where you birth, no matter who is present, no matter your circumstances or what happens to or around you. Each of us who births alone, just as we are pregnant alone. There's nobody doing the pregnancy but us. We have to do it, and we have to do the birth. Thankfully, after the birth, hopefully there are other people who help us raise our children. But some of us aren't. Some of us are single mothers. So if you want to try to avoid that unplanned cesarean because of a long first or second stage, then you want to really get stuck in and prepare your body, including doing the internal work in the birth canal and learning the skills and committing to using them. Because if you're not using a skill, then you're just reacting. And if you react, and they, the hospital staff, the obstetricians, midwives, labor and delivery nurses, see you getting out of control, they want to save you. And they do that by giving you the things they know, which is medical pain relief. So if you're coping well, you won't get an epidural. If you're not coping well, they're going to offer you one. So you need to understand that we discovered in the 70s and 80s that the unplanned cesareans came from our inability to get our baby out of our body easily. And it was highly tied to the fact that when labor started to really progress and the contractions got longer, stronger, and more intense, if we didn't have skills for coping, then we did things that were counterproductive to keeping the labor progressive. So if you're 36 weeks to 42 weeks now, then focus on the birth skills, but at least do some of the body work. You may not have time to do the internal work, but at least do some of the body work and the positions particularly, and the 5 phases of contractions and the progression of labor. It's really important that you keep your labor progressing, even if you haven't done a lot of the body work. So if you're going to end up with a non-labor, with a emergency cesarean, both of you, unplanned or emergent cesareans, there's going to be a decision to be made. You do not have to stop using your skills. None of us stopped using our skills. We just made the decisions. The more we were coping and managing, the better we negotiated. And that was true because if we were looking out of control, they didn't negotiate with us. They just tried to help us. You might not like how they're trying to help, but that's what they're trying to do. If we were coping well and managing well, we were more able to negotiate with them. And we accepted many things that we didn't particularly like. That's okay. Listen to my birth story in this and you'll find out. We just accepted it because we were in their sphere of influence. We didn't belittle them. We didn't have bad memories of them. We just went, this is what it is, and we're going to keep using our skills. We use them while being prepped, and we use them during the surgery, even if we didn't feel anything. Why? Because this is our baby's birth. Our baby is here now. Our baby expects us to be a skilled mother and father, and we are skilled now if we are skilled. And our baby appreciates that. Our baby appreciates knowing its mother and father or whoever else is with us is skillfully working to birth it and bring it forth from being pregnant to being in our arms. So if you have an unplanned cesarean or an emergency cesarean, don't skip a beat. This is your baby's birth. Just skillfully work through your baby's birth. And afterwards, if you have discomfort, just keep using the skills. These skills work throughout life in quirky, funny little ways. Fathers will often say, I had a tattoo done and I used the directed breathing. So just remember, Birthing Better Families are committed to having a high societal expectation that it's normal and natural that when we are pregnant, we self-learn birth and birth coaching skills that we commit to use throughout the activity of birthing our baby, because it's our baby's birth. So take care